right? And it means stretched over. It's a Greek word and it means stretched over. So it's a membrane basically which is going to be stretched all the way from the undersurface of diaphragm, from the abdomen down into the pelvis body. And it is going to stretch away along all the contents of the abdominal cavity. So it is defined as the large, thin serous membrane that lines. It's a large, thin serous membrane that lines the walls of the abdominal cavity, then the walls of the pelvic cavity here, right? And it is also going to enclose the viscera. Okay, so it is defined as the large, thin serous membrane that lines the walls of the abdominal cavity and the pelvic cavities and also clothes the viscera. You see, viscera question, right? It's going to enclose the viscera. The serous membrane, is basically it is composed of the basement membrane and the mesothelial cells. This single layered mesothelial cell tissue here, right? And it is going to line the cavities of the body, or which cavities of the body where the organs are present which are constantly on the move. For example, the pericardial cavity, the heart is constantly moving, like your thoracic cage, that is the pleural cavity, where your lungs are constantly moving, right? And then the abdominal cavity, you can see the contents of the organs of the gastrointestinal tract, right? You see there's a proportional movement, na? So that is also going to line this abdominal cavity. Is it clear, Vijay? And this one, because it always consists of two layers. The outer parietal layer, which is just going to line the inner aspect of the wall, and the inner visceral layer, which is going to line the viscera or organs. It's going to close the viscera. And these two layers are these are separated by the potential space, right? And that is called as a क्या होगा जी? उसी space होगी ये peritoneal space, right? So
yes, sir.
At this space, it is going to be filled with the fluid that is called as a peritoneal fluid, right? In case of the pleural cavities, that is the pleural fluid. In the case of the pericardial cavity, the pericardial fluid. And in the case of this abdominal cavity, that is a peritoneal fluid, right? And what is the purpose? The purpose again, wherever this sort of the arrangement is present, okay? जहाँ पे एक parietal layer है, then the visceral layer है, then between the layers there is a space filled with the fluid. तो वहाँ पे क्या है? The purpose which has to be served, that is lubricating the surfaces. Thus, for which purpose? To allow the free frictionless movements of the viscera. Is it clear? So the main concept behind the serous membrane is that it is going to be double layered, which consists of the parietal and the visceral layer, and between these two layers there is a space, and that space is basically filled with the serous fluid, and that serous fluid is required for which purpose? To facilitate the movements and allow the frictionless movements. Is it clear, Vijay? Now, as far as the peritoneum is concerned, again the peritoneum, it is again consists of the two layers: the parietal peritoneum, which is just going to line the inner aspect of the abdominal wall over here, and then the lower part over here line the pelvic cavity, right? And it is also going to line the undersurface of diaphragm here. You see the diaphragm, I told you, is a partition between the thoracic cavity and the abdominal cavity, right? So inner surface of the diaphragm over here, right? And from here it is going to reflect, and then it is going to be continuous with the visceral peritoneum. No, this layer, the parietal layer. So it is going to line the inner surface of diaphragm, extends from the inner surface of diaphragm, then the abdominal cavity, walls of the abdominal cavity, and the walls of the pelvic cavity. And here it is, you can see that it is loosely, attached with the abdominal wall. Okay. Why? Because between the parietal layer of the peritoneum and the endoabdominal fascia, there is a layer of the loose connective tissue. So it is loosely attached to the abdominal wall, right? So, it is, loosely attached. It can be easily stripped off. As I now, this, as it is going to line the or it is going to make the innermost layer of the body wall, okay, or the abdominal wall. It is going to receive its nerve supply and blood supply from the overlying body wall. Okay? It will form what? It will form the innermost layer of the abdominal wall. Okay? So इसकी जो nerve supply और blood supply है, it will be same, which is going to supply the skin to the endoabdominal fascia. ये इसकी जो thoracic wall, sorry, abdominal wall की जो blood और nerve supply आ रही है, वो सारी की सारी it is going to supply from the skin up to the parietal peritoneum. Is it clear? So what does it mean? That it is having the somatic innervation. ठीक है? Somatic innervation कौन सी होती है जी? Which is pain sensitive, which is like having the feeling sensation of touch, pain and pressure. ठीक है जी? So it is having the somatic innervation. Whereas the visceral peritoneum, it is again, it's the inner layer, right? It's the outer layer, it's in parietal peritoneum. In the visceral peritoneum, it is the inner layer. And it is going to line the surface of the organs of the viscera. Visceral, visceral means, visceral, this name is representing that it is going to line, but it is going to line the viscera. And it is, closely related to the viscera. And it is adherent to the viscera. It cannot peel it off. Okay? Viscera की जो outermost layer है, that is the, that is a visceral peritoneum. And it is firmly adherent to that one. And it cannot be stripped off. So its blood supply and nerve supply, it is basically derived from it must be coming from the nerve and the blood supply of the viscera. It is going to be lined. Okay? So yeah, just say this is a such a section, as you can see, this is in liver, and this the outermost layer of the liver over here, you can see this is the visceral peritoneum, and it is firmly related to, and it is going to get its blood and nerve supply from the same vessel and the nerves which are going to supply the liver. Is it clear, ji? The problem to nahi hai. And you see the other difference is that it is because these visceras, these are under involuntary control. So these are basically supplied by the autonomic nervous system. ठीक है ना? Involuntary है, ठीक है? That one, the outer one, जो thoracic wall, जो abdominal wall है, that is receiving nerve supply from the somatic nerve system, right? So this one for the viscera, that is the autonomic, that is under, it's not under your voluntary control, right? So if the sensations or in this region, that is basically the stretch sensitive. It will evoke pain only when there's a distension of the viscera. For example, in the case of the tumors, right? In any pathology, and which is going to involve the structure of the liver in case of the liver. So, or because of the ischemia. So any damage to the viscera can going to evoke the pain sensations. Is it clear, ji? Difference पता चल गया आपको? No, actually I was telling you the difference between the parietal peritoneum and the visceral peritoneum. Parietal peritoneum is going to line the walls of the cavities, whereas the visceral peritoneum is going to line the organs. It is loosely adherent. Parietal peritoneum is loosely adherent to the wall, whereas the visceral peritoneum is firmly adherent to the underlying viscera. So parietal peritoneum, it is going to receive its nerve supply and the blood supply from the vessels of the nerves supplying the wall, whereas the visceral peritoneum, it is getting its supply from those of the viscera. Okay? It is having the somatic, the parietal peritoneum, it is having the somatic innervation, whereas the visceral peritoneum is about the autonomic, right? Okay, it is the pain sensitive, having the somatic है तो ये is voluntary is system से related है और ये involuntary system से related है, right? And then this one it is having the feelings of the sensation of pain, pressure, touch, whatever, right? And the other one, this one, this visceral peritoneum, इसमें pain किस वक्त evoke होगी when there is the such when this viscera is going to be stretched due to any pathology. ठीक है जी? Okay. No, this यहाँ तो कोई problem तो नहीं है बच्चे? Parietal peritoneum में और visceral peritoneum में कोई problem तो नहीं है जी? Okay. No, these two layers, the parietal peritoneum and the visceral peritoneum, I told you, these two layers, they are separated from each other by this space. And this space is called as a peritoneal cavity. And you can see this peritoneal cavity is continuous from the inner surface diaphragm and up to the, up to the pelvis. In the males, it is a closed cavity. ठीक है जी, males में ये closed cavity है, whereas in the female it is not closed. कैसे जी? Why? In the males it is a closed cavity, whereas in the females it is not closed. So concept है जी. Which in the females, in the pelvic cavity, we have got the viscera. कौन सा viscera जी? That is, you see, here you can see, we have got the fallopian tubules, right? Fallopian tubules, these are going to open in the pelvic cavity. ऐसे ही है ना? Right? These are the openings. And this fallopian tubule is going to open into the uterus, and uterus is going to be continuous with the vaginal canal. And the vaginal canal is having a connection with the exterior, right? Is it clear? So,
yes.
So this peritoneal cavity is basically closed the males, but it is not going to be closed in case of the females. Okay. This layer, this peritoneal cavity, I told you, it consists, it is filled with the fluid. मैंने आपको बताया था peritoneal fluid की कितनी quantity मैंने बताई थी आपको. Which is what is the normal quantity of the peritoneal fluid? किसी को याद है? I told you about 20 to 50 millimeters.
Sir, 5 to 20.
ठीक है, 20 to 50 millimeters, right? And this more than the 50 millimeters, that is going to be, we're going to consider the pathological condition that is called the ascites, right? If जैसे आपने you normally used to hear you पेट में पानी पड़ गया, सुनते हैं ना आप आम फैम में लोग बात करते हैं किसी को ट्यूमर था या कोई प्रॉब्लम था, ठीक है, कोई टर्मिनल केसेस होता है, renal failure or hepatic failure, ठीक है, even the cardiac failure. Then in failures में there is a collection of fluid in the peritoneal cavity, and that is called as a ascites, ठीक है. Now that peritoneal fluid, normally it is straw colored, ठीक है, straw colored होता है, clear fluid होता है, right? And if this, in certain pathological conditions, if you have to drain, and you see when there's a collection of the fluid in the peritoneal cavity, then what you will do to relieve, we are just going to drain that fluid, ठीक है, that's called the pericentesis, ठीक है, that. So in that time, at that time, you see the fluid, you'll take out the fluid and you can see the color of the fluid, and that will help you in diagnosis. For example, if you see patient comes to you, right, and you're just going to draw that fluid, if it's you can, if its color is red, so that's called as a hemoperitone, and it is this colored fluid, it normally present in the in cases the tumors, okay. Sometimes it's yellow colored, right? So it relates to the liver disease. Sometimes it's whitish colored, milky, right? So it represents obstruction of the lymphatic system. And if it appears green, the green क्या होता है जी आपका?
Jaundice.
So green is basically that comes from the bile. In the case of the perforation of the gallbladder and lead to such a condition. Okay? And if you get there another term, that is the pneumoperitoneum, when you can see the air in the peritoneal cavity. ठीक है? और peritoneal cavity में air कहाँ से आती है? When there is a perforation of any contents of the gastrointestinal tract, especially when there is a perforation due to the of the stomach wall. ठीक है? Due to the chronic ulcers. जो अल्सर्स पाने हो जाते हैं तो क्या होता है, उसकी स्टमक वॉल जो समटाइम्स वहां से इसको बस करती है. समटाइम्स यू सी द because you see this your gastrointestinal system जो है इसमें the air flows, ठीक है ना, is open, right, from the oral cavity you take in the air, right, आपके इसमें air भी जाती है, right. So here you can see the air present in the gastrointestinal, sometimes to the perforation of stomach or any part of intestines or the colon, किसी भी organ की, when there is a perforation, the air can get out of this closed system, closed ductal system, and that is going to enter into the peritoneal cavity, and that term is called the pneumoperitoneum. If there is a blood in this peritoneum, that is called the hemoperitonium. Hemoperitonium normally present when there is a stab wound cases, okay, gunshot cases, right, okay. So all such conditions, these are related to the peritoneal cavity. Okay, you will be coming across during your clinical practice with the conditions like that, hemoperitonium, pneumoperitoneum. So it's all related, and they are responsible, to help you out with diagnosis. Is it clear? Now, as far as the peritoneal cavity is concerned, peritoneal cavity, I told you what it is, the largest cavity in the body. Okay, it's the largest cavity, extends from the intercept of the diaphragm and extends down up into the pelvis, right? So it's the largest cavity in the body. आपकी thoracic cavity is comparatively smaller one. The pericardial cavity it is much smaller. Is it or not? So the peritoneal cavity is the largest one, and it is going to be divided into two parts. The greater sac, okay, which is consists of the main larger part, okay, ये सारी की सारी, ये देखें, that is coming from the intercept diaphragm, going to enclose the liver, then it's going to enclose the here the stomach, and then in front of the abdominal cavity going down into the pelvis. So it's larger part, the main larger part, and it is named as the greater sac, SAC sac. ठीक है जी, ठीक है. And the another smaller part that is called as the lesser sac, and it is also called the omental bursa. और lesser sac कौन सी बेटे, you can see ये स्टमक के पीछे आपको स्पेस नजर आ रही है, below the liver, ठीक है, और ये स्टमक के पीछे ये this small space, और ये आप ये देखें, ये जो पेरिटोनियम जो हैंग डाउन कर रही है from the greater curvature of stomach, और यहाँ से रोल बैक होकर वापस आके यहाँ पे कॉलन पे टच कर रही है, right. So here you can see this space, this smaller space here, a limited smaller space behind the stomach and this two-fold layer of membrane that is called lesser omentum, ठीक है, यहाँ से और extending from the liver up to the diaphragm, this one, right. This is called as a lesser sac. So the main compartment, greater sac जो है वो क्या है? It's a main compartment that extends from the diaphragm and going downwards down to the pelvis. ये सारे के सारे, ठीक है. Whereas the lesser sac, it is the smaller one, and it lies behind the stomach. This is the stomach, and यहाँ पे आपको ये एक layer of membrane नजर आ रही है peritoneum की, peritoneum की, which is extending from the stomach to the liver, and this is called the lesser omentum. Omentum basically, beta, omentum is a term which we used for the peritoneum, two-layered fold of the peritoneum, ठीक है, which is going to connect the stomach to the other viscerals. ठीक है, ओमेंटम को पहले मैं डिफाइन करता हूं ताकि आपको थोड़ा कांसेप्ट क्लियर हो जाए कि ओमेंटम, मैंने एक वर्ड यूज किया ना, ये लेसर ओमेंटम, ठीक है. दिस इज स्पेस व्हिच लाइज बिहाइंड द स्टमक एंड द लेसर ओमेंटम, ठीक है. अगर आप यू आर गोइंग टू डिफाइन द लेसर सैक ना, सो इट्स व्हाट, इट्स अ स्पेस दैट लाइज बिहाइंड द स्टमक एंड द लेसर ओमेंटम एंड द लिवर, ये स्पेस, राइट. तो ओमेंटम, लेसर ओमेंटम क्या है? लेसर ओमेंटम जो है, it is, before defining the lesser omentum, I'm going to talk about the omentum only, right? Omentum is basically a double layered fold of the peritoneum, which is going to connect the stomach to the other viscera. ठीक है, तो आप ये देखें कि ये जो smaller part of this omentum which is going to connect the stomach with the liver, this is called the lesser omentum, and this longer part of the peritoneum which is going to connect the stomach with the transverse colon here, this is called the greater omentum. ठीक है, when you talk about the omentum दो किस्म के बेटे, एक greater omentum है जो कि स्टमक को कनेक्ट कर रहा है ट्रांसवर्स कॉलोन के साथ, ठीक है, और lesser omentum which is going to connect the stomach to the under surface of the liver, ठीक है. So lesser sac क्या है? It is a small space that is present behind the stomach and the lesser omentum and the liver over here. Is it clear बट्टे? Concept clear हुआ आपका? Greater sac और
Yes.
lesser sac का, ठीक है. ये एक लिमिटेड स्पेस है. लेसर सैक एक लिमिटेड स्पेस है जो कि लीवर के पीछे से आ रही है, लेसर ओमेंटम के पीछे से गुजरती है, स्टमक के पीछे से गुजरती है और ये एक्सटेंड करती है इस ग्रेटर ओमेंटम के अंदर. This is only the lesser sac. Instead of this one, this bigger, larger cavity here, all around the abdomen and the pelvis, that is called the greater sac. Is it clear, beta? Concept clear हुआ आपका? Now, these two sacs, ये greater sac और ये lesser sac, they are going to communicate with each other. ये दोनों आपस में communicate करती हैं. कहाँ से करते हैं? Behind this right free border of this lesser omentum by an opening. I just show you now. Now here you can see. यहाँ पे हमने क्या किया जी, हमने स्टमक को इस तरह डिवर्ट कर दिया है. स्टमक के पीछे ये जो स्पेस है, दिस इज द लेसर सैक. आई टोल्ड यू नो द स्पेस व्हिच लाइज बिहाइंड द स्टमक. ठीक है, यहाँ से स्टमक को हमने रिफ्लेक्ट कर दिया और ये जो स्पेस है, दिस इज कॉल्ड द लेसर सैक. नाउ दिस लेसर सैक इज गोइंग टू कम्युनिकेट विद दिस ग्रेटर सैक बाय दिस गैप, दिस ओपनिंग. यू सी द प्रोब. ठीक है, ये जो प्रोब है ये लेसर सैक से कहां जा रही है? ग्रेटर सैक में जा रही है. ठीक है, दिस प्रोब इज दिस ओपनिंग. सो दिस ओवल शेप्ड ओपनिंग here, it is called the epiploic foramen. ठीक है, or the foramen of Winslow, right? It is named the opening of the lesser sac or the opening of the Winslow or the epiploic foramen. Is it clear, ji? So these two cavities, the greater sac and the lesser sac, these two parts, they are going to communicate with each other by the opening, oval shaped opening, that is called as the epiploic foramina and the foramen of Winslow. Clear बच्चे? कोई प्रॉब्लम है तो मुझसे भी पूछ लो जी.
सर दोबारा रिपीट कर सकते हैं?
Right. I told you बेटा कि this peritoneal cavity, it is divided into two parts. ये तो क्लियर है आपको, एक ग्रेटर सैक है और लेसर सैक है.
यस सर.
कंसेप्ट क्लियर है? ग्रेटर सैक क्या होती है? द लार्जर पार्ट जो कि सारी पेरिटोनियल, एब्डोमिनल और पेल्विक कैविटी को कवर कर रही है, राइट. और जो लेसर सैक क्या होती है? व्हिच लाइज बिहाइंड द स्टमक एंड द लेसर ओमेंटम एंड द लिवर. ठीक है, अब ये दोनों जो है आपस में कम्युनिकेट करते हैं. इनका कम्युनिकेट करने का सिर्फ एक ही रास्ता है. ठीक है, वो एक रास्ता क्या है? आई टोल्ड यू, दिस एपिप्लाइक फोरामेन. ठीक है, एक और जगह पे आपको दिखाता हूं. यू कैन सी दिस वन. ठीक है, यहाँ पे ये जो आपका ये लेसर ओमेंटम है, राइट, विच एक्सटेंडिंग फ्रॉम दी लेसर को जो स्टमक से आ रहा है और ये ऊपर जाके लीवर में लग रहा है, ये लेसर ओमेंटम. और यहाँ से ना ये जो एक विंडो भी हमने काटी हुई है जस्ट टू शो यू द कंटेंट्स प्रेजेंट ओवर हियर. ठीक है, और ये आपको नजर आ रहा है ये गैप, this oval shaped opening, which is going to communicate the greater sac with the lesser sac. Now is it clear?
Yes sir.
Okay. Now there are certain terminologies when we were talking about the organs. So we use a term G, intraperitoneal, retroperitoneal, partially covered with the peritoneum, subperitoneum, right? So Okay, so you can see the term intraperitoneum. Intraperitoneum is a term when the viscera, it is totally covered by the visceral peritoneum. ठीक है जी? Right? Any organ which is totally covered by the visceral peritoneum, that is called as the intraperitoneal structure. ठीक है? Intraperitoneal organ, like the liver, you can see, then like the stomach. ठीक है? उसके बाद आपके ये jejunum और ileal small intestine की जो ये जो हैं coils of the small intestine, ठीक है? And the appendix, vermiform appendix. ठीक है? So these are the structures, organs which are called the intraperitoneal. The other one is the retroperitoneal. There are certain structures which lies behind. अब ये देखिए ये peritoneum आ रही है ना, ये पहली कैविटी से आ रही है, posterior abdominal wall पे आ रही है, right? यहाँ से आने के बाद it's going to reflect over from here. ठीक? Now there are certain structures which are lying behind the attachments of this peritoneum, parietal peritoneum. Now you can see. Just show you. Now this is the schematic, presentation. You can see, no? Now this is the posterior abdominal wall, right? ठीक है? वो ये आपकी parietal peritoneum line करती हुई आ रही है, right? When it will come over here, it is going to reflect over certain organs like this. ठीक है? This is a line of, the attachment of the parietal peritoneum along the posterior abdominal wall. So between this parietal peritoneum and the structure present between the posterior abdominal wall, ये जो structures हैं, these are all the retroperitoneal. They are lying behind the peritoneum, right? कौन-कौन सी होगी जी? Duodenum होगी, right? ठीक है ना? First 2 centimeter of the duodenum it is having the peritoneal attachment. उसके बाद सारे का सारा duodenum जहाँ से आपका ये small intestine start, right? So ये सारा का सारा duodenum it is retroperitoneal. Then we have got the pancreas. Then we have got, you see these kidneys, right? These are the kidneys on both sides. So kidneys के साथ the ureters are coming downwards. ठीक है? Is it clear? So all these structures, these are the retroperitoneal. They are lying behind the attachment of the parietal peritoneum. ये peritoneum के पीछे पर है. Is it clear जी? अच्छा, उसके बाद certain structures ऐसे हैं बेटे जो कि partially line करते हैं peritoneum के साथ, ठीक है? और like here you can see this one. These are the ascending and the descending colons. ठीक है? ये देखें ये इसकी एक साइड से दो they are covered from this side, its anterior surface, ठीक है? फिर this side is covered with the peritoneum and the rest of surface it is behind the peritoneum. ठीक है? So these are what? These are partially covered. These are partially covered, like the ascending colon, then the descending colon, and some part of the rectum. ठीक है? Is it clear? Concept clear हो गया बेटे? कि retroperitoneal concept जो कि सारे के सारे पूरे के पूरे peritoneal से पीछे हैं और फिर partially covered में हमारे पास ये ascending and descending colon आ जाते हैं. अच्छा एक और terminology term है जी, that is a subperitoneal. Now subperitoneal you can see this one. The structure which lies below the peritoneum. ये देखिए peritoneum यहाँ पे आने के बाद it's going to reflect from the anterior abdominal wall and is going to cover the passes above this is the bladder. ठीक है? ये urinary bladder है, but then it is going to passes above the this uterus over here. So these structures which are present below, these are the subperitoneal, just located below the peritoneal membrane. These कौन से जी? The urinary bladder river is there. ठीक है? The rectum, lower third of the rectum over there. ठीक है? और bladder के पीछे males we have got seminal vesicles. ठीक है? और neck पे यहाँ पे we have got the prostate. ठीक है? और in the case of female we have got the cervix and the vaginal canal, right? So these are the organs which are the subperitoneal. So when we are going to talk about these organs individually, then we are going to use the terminology. These are the intraperitoneal organ. This is a retroperitoneal organ. ठीक है? और retroperitoneal organ में when we take the name of retroperitoneal, तो आप आंखें बंद करके कहें जी this is इसमें कौन से organ है जी? Pancreas or kidneys, ureters, right? और किडनीज के टॉप पर भी एक और सुपररिनल ग्लैंड्स आपको पता ही है, राइट? सो सुपररिनल ग्लैंड, किडनीज, यूरेटर्स, दीज आर द रेट्रोपेरिटोनियल आर्टरीज एंड द पैंक्रियास. इज इट क्लियर जी? ठीक है, कोई कंफ्यूजन नहीं है? ओके, नो पेरिटोनियम करती क्या है जी? कौन बताएगा मुझे जी?
क्या सर?
व्हाट आर द पर्पस? ये जो पेरिटोनियम है इसका फंक्शन क्या है? एक तो ये हो गया ना, अदर
सर
देन द प्रोवाइडिंग द लुब्रिकेशन एंड कवरिंग द
सर
विसरास.
वो
दो का हम पढ़ चुके हैं ना. एक तो ये विसरा को लाइन कर रहा है, ठीक है, विसरा को कवर कर रहा है. तो दूसरा ये क्या है कि ये एक फ्रिक्शनलेस मूवमेंट प्रोवाइड कर रहा है. इसके अलावा इसका क्या पर्पस है, क्या फंक्शन हो सकते हैं जी?
सर ब्लड वेसल्स को पाथ प्रोवाइड करते हैं.
ब्लड वेसल्स को पाथ प्रोवाइड करते हैं. वेरी गुड, शाबाश. और you see which this peritoneum, it is thrown into the folds at certain locations, ठीक है. और at certain location when it is going to thrown into folds and it is going to perform different functions basically, ठीक है. At the specific places it is going to perform the specific functions. For example, I think I'm left with less than 1 minute, ठीक है.
यस सर.
I'm going to, you know,